Hey YouTube, I'm Kieran.
And I'm Brandon. And we know how stressful it can be to have a sick baby because they can't have like the same medicines that we can. So we wanted to make this video on like tips for taking care of a sick baby. So hopefully that can kind of take the stress away for you guys. If you find any of the information in this video useful, feel free to press the like button and subscribe button down below. That would be greatly appreciated. And let's get right into the video. So if you think your baby is in pain or like has a sore throat or fever, the two best things to use are Motrin or Tylenol. And actually, they're the only things really to use for those type of things for babies. And like we specifically use Motrin for our little one Cameron, and it's pretty easy because on the back of the bottle it tells you like for their age and weight, like how much to give them, and then it also comes with like a syringe with marks on it, so it's pretty easy to use, and it seems to help him whenever we give it to him. Like we even give it to him when he's teething as well, and it seems to like really help him at night. I sleep through the night better and all that stuff, so that's good.
To really help break up the mucus if your baby is really congested is using a cool mist humidifier in their room at night. It really helps to break that up and they can start to sleep better, so it's not so dry and they have like a dry cough.
If you get a Vicks humidifier, they also come with like or you can buy separately like the Vicks VapoPads, which is kind of cool. And we don't actually have one, but I've heard that they work well as well for the babies in their rooms at night. Something else that is good to help decongest them is in their baths, giving them like the Vicks VapoBath or another similar product. Or when you're taking a shower, if you bring them in the shower with you, the steam from the shower can also really help that.
We like to use saline drops. You can get them at any store, and it helps to loosen that mucus. You just spray it in each of the nostrils, a couple drops, and it really breaks down the mucus for them, so then their nose can run and you can get that bacteria out that's causing the cold or the virus. We like to use the NoseFrida. It's basically just sucks out the mucus in their nose. Because obviously you have to get the mucus out, and they don't understand the concept of blowing their nose or spitting if they like cough and they get the mucus up. So it really helps them get that out.
Yeah, another thing with the NoseFridas is to be kind of gentle, because if you're like aggressive with them, like in their nose, it can definitely aggravate their nose.
So you want to continue checking their temperature. You don't want them to get a fever, obviously.
Yeah, and if they do get a fever, I would definitely at that point contact a pediatrician just to see what they think you should do, because fevers are obviously never good for them. So
there's a couple different ways that you can check your baby's temperature. You can use their forehead, the armpit, orally, or through their rectum. We mainly use their forehead with a fast reading forehead thermometer. Is that what it's called?
yeah, they the slower reading forehead ones we've used, and they're kind of difficult to use because, at least for us, when you have the thermometer to his head, he likes to move around all the time, so you kind of need two of us there, one to like hold him down from moving, the other one to like hold the thermometer there for like a good 10 plus seconds until it reads. But the fast reading ones that kind of give you like an instant read are nice because, like I said, he'll move around and it's just quick. Like you're just checking and you're done. So it's really nice. Or the rectal ones are good too. Like while you're changing a diaper, you can just kind of check it real quick.
Yeah, pediatricians mainly recommend doing the rectum or the armpit or the forehead. because orally you usually put it under their tongue, but they're too kind of young to understand to keep it there for a long period of time, so they don't really recommend that. Cameron has had a cough for the past 3 weeks now, and we did contact our pediatrician and we got an appointment for him about a week and a half ago. They basically just told us to continue using Motrin or Tylenol, checking his temperature, breaking up that mucus with the cool mist humidifier, and then if we feel like it has worsened, just to call them. So, which we did because we felt that his cough was getting worse,
Yeah,
not really better.
we just called him. We just called them like the other day because it, like she said, it wasn't really improving, and it possibly even got worse. And it's been like a week and a half since the last appointment, so we just figured to call them. And one other thing they said that we didn't hear about before, but it's the to use children's Benadryl for him at night, and they told us to give him 2.5 milliliters of that. So they said that basically sometimes they can have a cough that lingers for weeks, and this might help. So if your baby has had a cough for a while, this is possibly an option, but I would probably ask your pediatrician first before you do that, because I don't know if that's good for like everyone, and I'm not really sure. So I'll definitely ask them first.
Of course, we always recommend just to contact your pediatrician if you have any questions or concerns for your baby.
But other than that, if there was any, like I said at the beginning, if there's any useful information here for that you guys heard, then feel free to press like and subscribe. And I'll also be posting links to some like the Vicks humidifier and some other things that we use down in the description. So if you are interested in buying any of those, there will be a quick link for you down there. But that's everything for this video. So we'll see you guys in the next one. Peace.
See ya.